Post-operative instructions from dental surgery. Congratulations, you're done. We hope the surgery went well. With proper anesthesia, you should have experienced little to no pain. Yes, it was weird with the pressure and instruments used in your mouth, but the numbing helped considerably. The anesthesia should last an additional 1.5 to 2 hours after surgery. Please wait for the numbing to go away before eating. You don't want to damage the surgical site or any numbed areas. Now that the anesthesia is wearing off, you should start taking your medications as prescribed. If taking a narcotic for pain, an ibuprofen such as Motrin can be used in between those pills to supplement comfort. Take your antibiotics as directed if also prescribed. Avoid alcohol for at least 2 to 3 days. Alcohol can dissolve your scab and cause more bleeding and pain. The scab, unlike one on your skin, is soft from the saliva. It needs time to fixate. Everything you will do is to keep the scab and surgical site as clean and undisturbed as possible. Smoking also should be avoided from the surgical site. It is the suction that can cause your scab to dislodge. Smoking also retards healing due to a lack of oxygenation. Your diet should also be soft. The rule of thumb is, if the food makes a noise, don't eat it. Wait for the 2 to 3 days for primary healing to occur. If a nut or lettuce get in the surgical site, the body can't break it down, causing a possible infection and retard healing. Pressure should be applied to stop any bleeding. Leave the gauze on for a minimum of 30 to 45 minutes. Your saliva may be red or pink for 2 to 3 days. This is the red blood cells mixing with saliva. If the bleeding is dark and thick and red, simply reapply the gauze for another 45 minutes. Repeat as necessary for 2 to 3 more times. If you're still bleeding, call your dentist. He will instruct you with further instructions. After 24 hours, you may begin saltwater rinses. You must gently swish to avoid disturbing the surgical site. Aggressive gargling can disrupt the scab. Do this at least 5 times a day. You must keep the surgical site clean to avoid infection. If you had a tooth pulled, follow these instructions to avoid a dry socket. Again, the scab is the most important aspect to healing. If dislodged, the resulting bone exposure creates an intense pain that needs to be addressed by your dentist. Your surgery may have had sutures, so you must avoid them at all cost. Try to keep food and your tongue away from the surgical site. Disturbing the surgical site can cause postoperative pain. Furthermore, if your sutures or dressing fall off, contact your dentist immediately. Brush and floss like normal, avoiding the surgical site. Again, keep your mouth as clean as possible. Ice pads can be used in the first 24 hours to minimize swelling. Keeping your head elevated can also minimize swelling. If swelling does occur, it will gradually diminish over 7 to 10 days. Your discomfort will get better every day after the surgery. By the time you go back to your dentist for your postoperative examination, usually 7 to 14 days, you should feel much better. Your doctor may opt to remove the sutures if you have healed enough. Complete healing, however, can take months. Any surgery involving the bone requires a minimum of 3 to 4 months before you're completely healed. You feel better once the gums have sealed.